Her husband, Homer Simpson, is at the bedside. All right, so this is the theme of what you guys need to do today. So I'm just gonna give you a little tidbit, okay? You're caring for a post-op patient on a med-surg unit. Okay, your task is to assess, identify priorities, intervene, and communicate changes in condition. We need phones. We don't wanna grab phones.
I'll grab phones, I'm going that
Gotcha.
way anyway, 'cause
Yeah, I'll give you a report. So Linda Simpson, 56-year-old female, post-op day number 2 after right total knee replacement. She's been complaining of increased pain and some shortness of breath this morning. Her last set of vital signs were with normal limits. They were in normal limits, folks, okay?
Yeah. Normal. Great.
They are within normal limits. Okay. I know.
What's your GCS?
What is a GCS? Okay. Okay. Her last set of vitals are within normal limits, stable, acceptable ranges, right? Mild tachycardia, about 104. So this is why I say not within normal limits, because 104 is not a normal limit, right? She's due for reassessment soon. Her meds have not been reconciled yet, and she is getting enoxaparin, but she was concerned last night, so because of the drainage and stuff on her leg, they did not want to, the pain and the drainage, they wanted to hold that. Okay.
She had a first dressing change yet post surgery?
Yes.
So this, okay, the surgeon has assessed and
Yes.
changed the first
Yeah.
dressing, okay.
Yes.
Is she A now?
Yeah, she just seems a little anxious, that's all.
Okay.
But yeah, and her husband's at the bedside.
How's her labs?
I haven't looked at anything yet.
Okay, is there labs available?
I'm not sure, I haven't looked at the computer.
You're such a good
Nurse Sally.
Yeah, well, you know,
We all know Nurse
Are you
Sally is a
EMS?
terrible.
I didn't feel well, so I kind of like slept through half my shift, and I just ran around early this morning, took care of my 8 patients, so.
Oh, okay.
Yeah, she was the last on my list, so I'm sorry, I didn't really do much for
And
her.
then you said she's in pain, and what's her last pain?
I didn't give her anything.
Yeah, okay.
So.
Actually, you did.
Did I?
She got acetaminophen
Oh, she got
at
some Tylenol?
15 minutes after midnight. At about 1:30, she got a Norco, and at about 3 o'clock, she got morphine.
Thank God my preceptor's there to help me out.
Oh, yeah.
So.
Morphine, Norco, what else was the first?
Tylenol.
Okay.
They're all in the MAR in case you forget the times.
Oh, they
Is that
are?
what
Yeah.
I'm on?
Did you pull up her?
Didn't think we had a MAR.
We do, we have a MAR.
It's 7 a.m.
So we're well within what you
Yeah, last
Very
night,
abbreviated
the
MAR,
pain
but there's
was
a MAR.
6/10, I think, before my preceptor medicated her with all that stuff.
I think you said 6/10. Got my time.
Yeah. 6/10.
What? What's 6/10? Oh, the pain, okay.
6/10 on a pain scale of 0 to 10.
Okay. Says, that better not be a blood pressure, that's really, she's dead.
Any other questions for me? So, her meds are in the MAR, and we're waiting on labs and stuff like that.
What was her first name again? Sorry.
Linda.
Linda.
Okay.
Linda.
Simpson.
Listen, Linda.
We should have named her Karen.
We should have named her Karen, yeah.
Yeah.
No.
Linda.
I like that. Now we really know.
Oh, Linda and Homer. Okay.
I love that. Yeah.
Or actually, if we're gonna keep
No,
her
she's
Simpson,
not
then they were Marge next time.
You need
You
the,
gotta
you
give her
need the
blue
wig
hair.
though.
Yeah, the
You need
blue
the
hair.
wig. You need the wig.
I will look for that on Nellis
Some
Auction.
fluids, what's the
Yeah, what's the
story with
fluids?
fluids?
Yeah, it's not running, I don't know. I truly haven't looked at any orders or anything, so you might have to review the chart.
There are no fluids, just pretend that's not
Okay.
there.
Oh, okay.
Yeah, I just left it there. I didn't have any caps on me, so I left it attached.
No, we wouldn't want to make you anxious.
Poor Linda.
Maybe that's why she did.
Yeah, so, yeah, I really need to go to sleep. Are you done with me?
It's tough out there, so get home safe.
It is.
Yeah. Break a leg.
Gonna go get some coffee.
You might want to reconsider being EMS.
I'm a nurse.
What kind of cereal
I'm not
do you
EMS.
eat? Just wondering about the cereal box thing.
Cream of wheat.
Okay, that's good. All right. Very good. Thank you.
I did eat Wheaties, but I thought they
You missed
caused
your-
transition, so.
We missed our Wheaties. What?
That was horrible.
Do you
I'm
have
sorry.
Fiesta plates?
The professors are getting spicy on this last one.
Alright, BSI seen a safe?
I think Linda Pell.
Hand sanitizer, gloves.
I don't know why I added an N.
Ready? Ready?
This is backup.
You're like a walk.
Are you okay?
Oh my god.
It happens once in a while.
Jesus.
I got that on film.
Good.
We're gonna be nurses.
Yeah.
All
Yeah,
right.
did we ever?
What do you need?
We're good,
Radio?
we're good, we're good, we're good.
You got a radio?
It's right there.
She said she left hers there.
It's right there, too.
You don't have the radio. Oh, you don't have yours.
Oh, nothing.
I need nothing.
It's last row.
Hell yeah, brother.
What's that?
BSI seen is not safe.
It's glass, not like a method with a knife.
Did you check the back of the glass?
Yeah, all right. Whenever you guys are ready, I'm just gonna grab my folder.
Okay, we'll wait for you to get back in that. Yeah.
Poor Linda.
Just gonna take a breath. You okay?
You're waiting on me. I figured I'd take my time.
Poor Linda.
Knock. Hi, Linda. My name is Emily, and this is Oksana. We're gonna be your nurses today. And who do you have with you today?
I'm Homer. Nice to meet you guys.
Nice to meet you. All right, Linda, can you tell me your name and date of birth?
Linda Simpson, 515 SF.
All right, and can you tell me what's going on today?
Oh, I have a whole lot of pain, in my knee, in my leg, below the knee.
Okay.
Sometimes I'm having, chest pain, kind of off and on, and it's usually, when I breathe.
When you breathe, okay. Oksana's gonna take a little look at your extremities here and your knee. I'm gonna take a little listen to
So
your
let me
lungs.
tell you, she has not been feeling herself. She's
Okay.
been super weird, saying weird stuff. I don't know what's going on.
Okay. What kind of weird stuff?
She's just been saying funny things. Like she's just like not herself.
Okay. When I check for CMS on the extremities, do I have equal pulses? I forget if the feet have.
You'll be okay.
Yeah, they do. Yeah, you should.
You have equal pulses, right calf is slightly swollen and lung is attached.
Okay, so we have some edema. We wanna take a look at the knee.
Do we see any like obvious drainage, bleeding, anything coming from the bandaging?
There's no obvious drainage at this time.
Okay, any redness, swelling on the knee?
Not at the knee.
Alright, not at the knee, just the foot. Alright, I'm gonna take a little listen to your lungs, Linda.
While you do that, I'm gonna
Let me take some deep breaths for me. Finish breath sounds on the left lower lobe.
Is everything okay?
We're working on that. We're just kind of giving her a little assessment to see how she's doing. So, Linda, do you know what year it is?
It's 2026.
Okay. And you know yes, I'm gonna ask again, you know why you came into the hospital?
Yeah, I had a knee replacement.
Okay. Alright. So take a little look at your abdomen here. Any belly pain or anything going on?
No belly pain, her abdomen is flat, well, she's obese, but it's not.
Okay. And I'm gonna take a little look at your eyes here and mouth. Anything in her, anything abnormal with her eyes, mouth, nose?
Everything with her eyes, mouth, and nose is normal.
Alright. I'm gonna check 104, she's tacky.
You're good, you're good. So
They
can you,
withheld the toxin, right? Yeah.
can you tell me a little bit about the chest pain that you are having? Or were having?
It comes and goes, it seems to hurt when I breathe in, and when the chest pain comes, I feel like there is something really, really, really wrong with me.
Okay.
When's the last time most recently that you had it?
20 minutes ago.
Okay.
Okay. Do you have feelings of impending doom?
What is that?
What is that?
Like in a sense of anxiety.
Yeah.
Like, is she gonna die if she feels like that?
No. Well, most likely not.
We're concerned about, you know, if she has, any with, you know, the chest pain, difficulty breathing, we just wanna make sure that we get all the information before we call the doctor, so that we can give the best update.
Okay. Cool.
Okay.
I'm not sure that I'm saying you, but when the chest pain happens, I feel like there is something really seriously wrong with me.
Okay. And how would you describe it? Is it sharp and in a specific place, or is it squeezing? Is it pressure? Does it radiate?
It's sharp, it doesn't really radiate, it's just kind of all over my chest. And it hurts worse when I breathe in than when I breathe out.
She's down to 9%.
Okay, let's put her on.
How many liters?
2 liters.
2 liters.
Yeah, it looks like she's kind of breathing funny right now.
I'm having trouble catching my breath now.
Alright, let's give the doc a call.
Yeah.
Are you okay, honey?
How you doing, Linda?
I feel like nobody said something wrong with me. I don't know.
Put you on some oxygen.
Ring, doctor.
Is that gonna help her?
Yeah, it'll help good for first.
This is your doctor. Hi, everyone. I'm Sana. I'm a nurse on med-surg with Lisa Simpson. She is a 56-year-old female.
Well, we're not going there yet.
I'm just a little nervous.
Yeah.
Her
We're gonna
SpO2
call the
is
doctor.
declining. She's at 86%
Get her taken care of.
on 2 liters, was previously on 1 liter. Respiratory rate is elevated at 30. She's tachycardic at a heart rate of 126. And her blood pressure is 136/80. They did hold her enoxaparin this morning and were concerned about a possible leak.
Please don't leave me.
We're right here.
I think we need to get the doctor in here.
Yeah, I think she's down to 85.
She doesn't look so good right now.
We also did just move her up to a non-regulator because her SpO2 is
126. That hurt me.
She is becoming.
Can't we hit a button or something and call somebody? Can I hit one of these buttons to call a doctor?
I'm on the phone with the doctor right now.
Call the doctor right
Oh,
now.
okay.
Okay.
Non-rebreather on?
Okay. Doctor's on his way. Okay.
Okay.
In the meantime,
Doctor's
let's get an EKG.
Okay.
Right? We're allowed to do that as nurses. We can just get one.
Yeah, we can call for one or we can do one ourselves. Okay.
God.
You could have stayed in the chair. You need to sit
We're
right
getting
there.
it well.
You need to sit right there now.
That's not an EKG.
Someone had jumped on
We could. Yeah, we did. Wouldn't it be real life? I barely start there.
Linda, how are you feeling?
I feel dizzy.
You feel dizzy? Okay, how's that? You have any chest pain?
Are
Open your things,
What are
open
we,
your things.
are we
Yes.
doing
Open
anything?
your things.
I feel like we aren't doing anything.
That's your role.
Please call somebody.
Hi, Mr. Homer.
What are we doing?
What's up, guys?
Save her!
Oh, is she in cardiac arrest?
Who's CPR? Who's CPR number 2?
Let's check for a pulse, guys.
Who's the team leader?
Save my
Is
Linda!
that what your taxes?
Please save her!
Alright, sir. We got you. Still has a pulse. Alright, assist
She's
respiration.
not breathing!
Who's the charge nurse? Who's the charge nurse?
Hey guys, so let's get one breath every 6 seconds.
Respiratory.
Let's run another set of
Shouldn't we
vitals.
be pushing on her chest?
She has a heart.
Hey sir,
Oh, okay.
I'm gonna get, I need you to keep, just sit there.
Okay.
Keep quiet, I got you.
Keep it.
Take it through.
I just don't know what's going on.
Move your hair, Christina.
Actually, have my hair up, bro.
So let's run another set of vitals. Just-
We're not getting a fluctuate anymore.
Do we have a pulse?
Okay, I wanna.
No pulse, alright,
Compression
start
started.
CPR.
Oh
Who's
my
recorder?
god,
Alright,
she's
sir.
dying!
Hey, I'm gonna have you sit in the quiet room, so step out there.
Oh
and we'll get right
my
back
god.
Here. Alright, who's recorder?
I'm the recorder.
Recorder. Alright, so meds, alrighty.
Who's on meds?
Perfect.
Alright, pulse check. We can turn him and get the other pad on the back, okay?
No
Help
worries.
you.
I'm a lot shorter than you
Who's
two.
behind on compression?
So we got compressions, you got defibrillator, your meds, your CPR2 backup, perfect. Alright, let's establish an IV. Meds, I'm gonna have you do that IV, just make sure it's there. We'll get a round of epi going for right now. We still have about 1 more minute until we have pulse check.
Is she alive yet?
You're in the quiet room, you can't be in here, so I sent you out, security's with you.
No, he stays. He stays. He doesn't.
I don't know what I'm doing.
I just had security get him out because he's talking too much, no?
Yeah. He can't. You can't make them leave in a code.
Really?
Absolutely.
Hey, buddy.
We actually
hang out with me.
encourage them.
Okay. Oh, okay. All right. So what we're doing right now, we're trying to figure out what's going on. It sounds like
She
she
looks like she's dying.
So right now we are preventing her from trying to prevent that from happening.
Is she dead right now?
Alrighty. So right now,
Turn 2 minutes,
she might have a blood
Pulse
clot,
check,
and we
pulse
gotta.
Oh my god, that sounds serious.
All right. So pulse check. Do we have a pulse? I see no pulse. PEA. Continue CPR. All right. The time is now 57. Let's do 1 round of epi, please.
Alright, Epi.
How much? 1 milligram of
1
epi.
milligram.
1
Going
to
in.
10,000. All right. Let's prep amiodarone and another epi on the side. Keep that going, and then all right. Sure. Let's see. Primary nurse. What medication did we give her? Anything before this?
No, she had last med. She had morphine at 3 o'clock.
Okay.
Yeah, so she hasn't had any recent meds.
So 3 o'clock, and it's now what? In make believe land. Not a problem.
I
Either way,
don't
it's not a
know.
problem.
Yeah. No idea.
Okay.
You already got a timer on this if you guys want
I got the clock right there. We got 1
Okay.
minute. So you have
1 minute till pulse check.
about 1 minute to pulse
Yeah,
check.
you had 30 seconds.
Okay.
Oh, okay. What clock are we
Roxanne,
going
are you
to?
next on compression?
Music's fine.
Alright.
Shouldn't we just like zap her?
So we might, what we'll do is if the heart's freaking out, we'll zap it to get back. But right now we're worried about this freaking not pumping.
Okay.
So let's charge to 120. Continue CPR until I tell you to stop.
Okay, pulse check.
Alright, let's do a pulse check. Do we have someone check for a pulse?
No pulse, BFib.
BFib,
Fine.
fine BFib. Alright, let's continue CPR while we charge up.
Why is it
So, let's go. Load. And then charge. Alright, hold on. Keep going, keep going. Okay. Alright, everybody clear? Alright, we're all clear. Discharge the current. Hit shot. Okay, just press down. We'll pretend like we did it.
Yeah, just press down.
Okay.
Did that hurt her?
CPR.
That looked like that hurt.
All right. So now let's get that amiodarone on board.
No one's talking to me. I don't know what's going on.
Facilitate the 300 milligrams of amiodarone right now.
Alright, any other?
My wife.
300 milligrams?
You need to save her.
Sir, you need to back to the quiet room so we can work.
Where's the
But I need to help too.
Do you pray?
No.
Do you
No.
have any like wishes that you want to
Pardon
say?
me?
Save her. That's what I want.
Okay. Thanks for the encouragement.
Oral airway inserted. LMA inserted.
Alright, so now what we're gonna do is continuous compressions, 1 breath every 6 seconds, alright?
My hammies.
Next, pulse check,
So
I
is
want
her
you to
heart
switch with,
working?
Oksana, is that cool? Awesome. Alrighty.
I thought we just zapped her and it would have brought her back.
Yeah,
We're gonna check.
6 seconds.
Great.
5 seconds.
Alright. Charging to.
Alright,
Because next month we're gonna
Hold
review
on.
the valves.
Keep
She needs
compressions
to
going,
be
keep
there.
compressions going, keep compressions going.
Get her
Alright,
back.
everybody clear?
Clear.
Pulse check.
Okay.
Sorry, pulse check and then I'll see what's that.
Fine, Ethan.
Are you shocked? Okay.
Yeah, he's fine.
Alright,
No
yeah,
pulse.
I agree, fine VFib, everybody clear?
Clear beer.
Clear? Shocking? Continue CPR?
Sim over.
Okay.
Go team.
I used to like because that might have been an artifact. I was like, VFib, you know, I was like, it's fine VFib.
What do you think, guys? You have a good time?
Oh, yeah.
Yeah.
What do you think's wrong with her? Good
So,
job.
so that was one of the things that you guys probably should have started discussing, okay? So, couple things in the code, of course, she was on the med-surg floor, and the family was visiting. We never send the family away.
Didn't know that.
We never send the family away. What you would have done was change between your compressors and say, okay, she's not compressing, right? I need you to come over here and have a conversation with the family. Let them know what we're doing.
Oh, okay.
Okay?
Cool.
Yes, that's what you do.
Okay.
Do not ask them to leave. You don't send them to a quiet room. You don't have security remove them.
Nice.
You know what I mean? If they're laying over the body, that's different.
Okay.
Then, like, you know what, come here, let me have you stand over here, I'm gonna have a nurse talk to you,
Nice.
okay? So, that way, because statistically, and studies show that when families are there at the bedside, then they realize you did everything you could to save their loved one,
I
okay?
came over and was telling them that. I was
Yep.
explaining what was happening. why
Absolutely,
we
and
were
then,
upset.
when I said you can't leave the room, you started talking to them, which is great. Anybody can do that, and sometimes you can even have called clergy. You know, if you know, this is
Social worker, if you have a social worker in your
call
hospital.
anybody, you can take one of your ER techs, you can take a CNA on the med-surg floor, anybody, and just say, I need you to stand here and talk to the husband and let them know what's going on. Right now, they're trying to get her heart beating again. Right now, they're doing this, they're giving her medications to, so we don't ever kick the family out,
Okay.
okay? You also intubate,
With an LMA, yeah.
absolutely.
I guess
Okay,
I was
but you
thinking
guys do
afterwards.
know in ACLS, unless you are meeting resistance bagging, you do not take the time to intubate. Okay? Yes.
We didn't
Yes.
cause
I-
any questions for him to put it in.
So it was an
I just-
LMA.
Understand, but I'm just saying in general, I'm talking about intubation, what you guys did is fine.
Okay.
I'm not saying that was wrong, but if a doctor wants to say, okay, I'm gonna intubate now,
Stop compressions, we don't normally wanna do that
Right.
if there's no airway
if you're not
resistance.
having trouble giving them air, okay, because how does it go now? CAV, you are circulating, okay? So if that is your focus, all right? If afterwards, if you get her back, okay, then take that time to intubate.
So my only pushback was I think an LMA is the better way to go to keep
Do
circulation
you think you're gonna have an
going.
LMA available?
An IGEL? Yeah.
Yeah,
Yeah.
Better in the crash bar?
Yeah.
you think so?
Yeah.
Okay.
I'm used to IGELs around.
You're used to riding the ambulance too.
No,
But
like,
also,
at, like, Sunrise
according to
and-
ACLS and LMA, you even though, yeah, it is an airway, it's not considered to be an advanced airway, so you can't bag during compressions with an LMA. Only with a combo tube or, well, this is what ACLS says.
Just
Only
ACLS,
with-
okay?
only with a
So
combo tube
we
or
are-
an
we are all-
actual ET.
Remember, we are living in that perfect world. Everything works and everything's beautiful,
They
right?
did just have a 2026 update, so I wanna know, I'm curious.
Maybe they're gonna change it. Maybe they
I
are.
will go look at my
I
updates. I'll check it
truthfully,
out.
I truthfully would go back to letting the doc incubate, you know, I mean, most of them are really precise, really good, and it doesn't take that long.
Yeah.
So you're not perfusing.
The way that,
Especially since you can continue doing compressions until they have everything open and in their hand and ready to go.
Right.
Then it really only takes a few
Right.
seconds. for them.
And literally, you are still doing compressions until they pull out that stylet and go in.
we
Right.
usually do, like, we'll do kind of what you're saying, like, we'll set up during compressions and then during a pulse check, that's when we.
Yes, yes, yes. So just put, I know you're not happy with any of these answers, okay?
Okay.
I understand that, and I can appreciate that, all right? It's just, if you ever were asked, what order are you gonna do things in? Intubation is not one of them.
No, I agree.
Okay, so that's all I'm saying. But kudos to you for taking on that.
You guys ran a
on
good
the dog.
code.
You guys ran a great code,
We had a good leader.
You had a good
Great
compressor,
you know?
and someone talked to the family members, at least, thank you.
But
Maybe
yeah.
while doing compressions wasn't the best time to be like, do you pray?
Yeah. While smiling at me.
I didn't hear that.
I was just staring at you like, oh my
And I say that they
god.
did, and then I was like, do you have any last thoughts?
And he's like, I know we're alive. So, anyway, so how did you guys feel about being surprised at what you were doing?
I was excited.
Yeah.
Okay, that little bit of adrenaline kick in when you're like, oh no,
Yeah.
I gotta open this and do this. Okay.
So,
And maybe
was
you
this
have
better
been
because you
this.
knew we weren't judging you? You
Yeah.
knew that it was just for fun? Did that
We don't
make
generally
more
judge
willing?
you anyway.
We don't judge you
because-
anyway.
Lies.
So, we give you,
Judgments in.
I am giving you
you guys
constructive
judge yourself
feedback.
based on our constructive feedback. We don't judge you, this is, truly, every single sim is a learning experience.
Yeah.
You know, and we don't judge you during the learning experiences, and when we tell you something that you did that maybe was not very appropriate, it's because we want you to learn from
The
it.
whole, right, and the whole idea, and I think you've heard us say it before, is if you do anything here that is wrong, which nobody did, you can't kill Simban.
Because we can
Okay?
bring him back to life as
We
many
can bring it back
times
to
as we need
life
to.
anytime.
Amputate them.
And you can amputate them too. And then we
Speaking
can
of amputation, are we
reattach-
ready for
we
our
can
award
fix that.
ceremony?
So, no,
Yes.
was there anything else?
The
The shock.
intubation.
No, no, other than that in the family.
Spray to
And the
shock.
family just points over.